In this podcast episode, Mark Hyman is joined by Dr. Marty Makary, a prominent surgeon and professor at Johns Hopkins University, to discuss the alarming trends in modern medicine, particularly the overmedication of patients and the influence of Big Pharma on healthcare practices. Dr. Makary, known for his outspoken views on the healthcare system, sheds light on the complexities of medical practices, the role of the microbiome, and the urgent need for reform in medical education and policy. Dr. Makary begins by addressing a concerning trend: the rise of colon cancer in young, healthy individuals. Recent research has highlighted a potential link between this increase and factors such as being born via C-section and the state of the microbiome. The microbiome, a complex ecosystem of bacteria in our bodies, plays a crucial role in various health conditions, yet it remains a blind spot in traditional medical education. Dr. Makary emphasizes that many chronic diseases, including obesity, diabetes, and even certain cancers, are influenced by the health of our microbiome, which is often disrupted by antibiotics and poor dietary choices. A significant portion of the discussion revolves around the pervasive influence of the pharmaceutical industry on medical practices and education. Dr. Makary expresses concern over the co-optation of medicine by corporate interests, where the focus shifts from patient care to profit. He notes that many doctors feel like cogs in a machine, afraid to speak out against the status quo due to the potential repercussions on their careers. This culture of silence contributes to a lack of accountability and transparency in healthcare, leading to practices that prioritize financial gain over patient well-being. Dr. Hyman and Dr. Makary delve into the issue of pricing in healthcare, highlighting the absurdity of the cost discrepancies for the same medical procedures. They share personal anecdotes about the staggering differences in prices for MRIs and other treatments, illustrating how patients are often left in the dark about the true costs of their care. Dr. Makary's book, The Price We Pay, addresses these issues and advocates for greater transparency in healthcare pricing, which he believes is essential for rebuilding trust between patients and providers. Dr. Makary's work emphasizes the importance of accountability in medicine. He argues that the current system often fails to hold healthcare providers and institutions responsible for their actions, leading to a culture where mistakes are hidden rather than addressed. He advocates for a shift towards transparency, where patients are informed about the risks and benefits of treatments, and where healthcare providers are encouraged to admit when they do not have all the answers. The conversation also touches on the challenges of medical education, where students are often trained to memorize information rather than think critically about patient care. Dr. Makary highlights the need for a more holistic approach to medical training, one that incorporates nutrition, lifestyle factors, and the microbiome into the curriculum. He believes that by equipping future doctors with a broader understanding of health, they will be better prepared to address the root causes of disease rather than simply treating symptoms. The discussion takes a turn towards the topic of vaccines, particularly in the context of the COVID-19 pandemic. Dr. Makary shares his perspective on the booster shots for young, healthy individuals, questioning the necessity and safety of such interventions. He cites data indicating that the risks of myocarditis associated with the vaccine may outweigh the benefits for this demographic. This stance has drawn criticism, but Dr. Makary emphasizes the importance of open dialogue and the need for evidence-based discussions about vaccine safety. As the conversation progresses, Dr. Hyman and Dr. Makary explore the recent popularity of GLP-1 agonists, medications that have been touted as miracle drugs for weight loss and metabolic health. While acknowledging the potential benefits of these drugs, Dr. Makary raises concerns about their long-term effects and the risk of over-reliance on pharmacological solutions, rather than addressing the underlying lifestyle factors contributing to obesity and metabolic disease. He advocates for a more comprehensive approach to health that includes dietary changes and lifestyle modifications. Dr. Makary concludes the discussion by emphasizing the need for a paradigm shift in healthcare. He envisions a future where patients are empowered to take control of their health, where transparency and accountability are prioritized, and where the focus shifts from treating diseases to promoting overall wellness. He believes that by harnessing the power of technology and data, healthcare can become more personalized and effective, ultimately leading to better outcomes for patients.